Cardiomyopathy is related to primary myocardial muscle defects. There's three types: dilated, hypertrophic, and restrictive. All three lead to two common endpoints: congestive heart failure from systolic or diastolic dysfunction, and/or cardiac arrhythmias from disruption of cardiac architecture. The heart of dilated cardiomyopathy is enlarged with dilated atria and ventricles. The etiology is most often idiopathic. It can also be caused by drugs such as doxorubicin, alcohol, myocarditis, either viral or parasitic etiologies. Pathogenesis, dilation causes systolic dysfunction, which leads to congestive heart failures with its signs and symptoms. Patients may also develop valvular insufficiency from the dilation because of widening of the valve ring. Here you can appreciate the increased ventricular chamber size, thinned out ventricle, increased atrial chamber size in the setting of a dilated cardiomyopathy. And here on gross, again, so a thinned out ventricle, dilated with respect to both the ventricles and the atria. In hypertrophic cardiomyopathy, you get selective hypertrophy of particular parts of the left ventricle, especially the interventricular septum. 50% of the cases are familial, inherited in an autosomal dominant fashion. They can also be idiopathic. You have a large septum which obstructs aortic outflow. This disrupted architecture can lead to conduction disturbances and arrhythmias. These patients are at higher risk for sudden cardiac death due to ventricular arrhythmias. The muscle thickening also causes diastolic dysfunction and ultimately can lead to heart failure. Clinical pathology, the obstruction to outflow causes exertional dyspnea or syncope or angina, and can often cause sudden unexpected death in young adults. You have, in restrictive cardiomyopathy, you have decreased ventricular compliance or a stiff heart. Etiologies of restrictive cardiomyopathies include infiltrative disorders such as amyloid or hemochromatosis, sarcoidosis, certain liposomal storage disease, Pompe disease. You have decreased compliance, which causes diastolic dysfunction and heart failure, and inability of the heart to relax, which leads to the same constellation of symptoms that you would see in other etiologies of heart failure. So in restrictive cardiomyopathy, you have LVH, you have thickened interventricular septum, you have decreased ventricular chamber size.